Hello, I'm Dr. David Hornbrook with another episode of View from the Other Side of the Bench. Today we're going to talk about provisionalization when you're doing multiple restorations around an implant abutment, and how do we provisionalize that? You know, this is a case that Jacob here at Utah Valley Dental Lab did, and he did an amazing job, where we have an implant replacing the right maxillary lateral incisor. And the doctor wanted to go ahead and prep 9 units around that. And so what's going to happen is the day that the doctor torques down this implant abutment, we then will prep the rest of the case around that. Now they need to provisionalize it. So you can see from this photo, this is what we call an H abutment. It's a titanium base with either lithium disilicate Emax or zirconium dioxide over the titanium base. And we went ahead and put the margin just slightly subgingival. We stain, ceramic stain, any of the abutment that is below tissue, we stain it pink in case we get any shine through. And then the coronal aspect of the abutment is tooth color. In this particular case, it's about A2. So we look at this case and we think, okay, how are we going to provisionalize this abutment? You know, the thing we worry about with our implants, especially anterior implants, is maintenance of the papilla. So we want to make sure that 2 to 4 week time that this patient's in provisionals, that we do everything we can to make sure that the provisional over that abutment is as accurate as possible. Most of the time, and a lot of you know this from those that went through our courses, when we do provisionalization on these anterior cases, we do what we call a shrink to fit technique, where we go ahead and utilize Luxitemp. We use a matrix, put on the teeth, let it sit for 2 minutes, pull off the matrix, then clean up the excess, and we just leave that in place. They look great, margins are great, but for a full crown on an implant abutment, to get that provisional, that shrink to fit on that abutment as accurate as we would like, especially interproximally, is difficult. So what we do in this case, and it's a very cool thing to do, is you can see the abutment. So the abutment is on the model, soft tissue models we use with our implants. The rest of the case is waxed into place. So after the implant abutment is placed and the doctor preps the rest of the units, they take their impressions. Now they need to make provisionals. So what Jacob did, he made what we call a PMMA, which is a polymethyl methacrylate that is designed the same way our Emax and our zirconium is designed on 3-shape, and then it's milled on the same machine that we mill our zirconium. So you can see here on this picture that it looks like an all ceramic crown, but it's actually resin, and it's very, very affordable, and it fits great. So what Jake did, he went ahead and designed the case, and then this PMMA fits over this abutment. Now it's important when you do this, make sure that you give the ceramist the shade that you're going to utilize for the provisionals, because unlike a wax up where we don't need a shade, we do need a shade because we're going to actually put this into place temporarily over the abutment. It fits excellently. Then we make 2 separate putty matrices, because now we have to provisionalize the 3 units on the upper right. So we go ahead and cement this to place. We can now fill this with Luxitemp, a shade that matches this PMMA. We go ahead and put it to place over that abutment, and we'll go ahead and make our very accurate 3 shrink to fit technique. And then on the other side, where we have 5 units, or 6 units actually, because we included the right maxillary central, is this will be filled with Luxitemp and put into place. So after that 2 minutes, we go ahead and pull off the putty matrix, we clean up the excess, polish it, adjust any occlusion or contacts we may need to adjust, and then we go ahead and seal it and polish it up. So over the implant abutment, we have basically a very accurate, almost like a definitive crown accuracy. And so next time when this case is going to be seated with ceramics, we take off the temporaries, we just slide this PMMA off, the tissue looks immaculate, and then we can go ahead and seat the rest of our case. So just a cool little tip, a little trick that again is very, very affordable. I mean, these are, I think, $59 to $69 for this PMMA. And it makes my life easier because I'm not trying to make the provisional on that implant, again, utilizing Luxitemp and fussing with that. I just put it to place, make the rest of the provisionals, take it off on cementation day, tissue's immaculate. So I hope these little pearls are becoming some use to you, and try that next time.